There is a sound in your ears right now, a ringing, a buzzing, a high-pitched tone that never fully goes away. It is there when you wake up. It is there when you go to bed. It is loudest in quiet rooms, when there is nothing else to drown it out. You have seen doctors. You have had hearing tests. You have been told your ears look perfectly normal, and the response is almost always the same. That is tinnitus. There is nothing we can do. Learn to live with it. I want to tell you something that 13 years of clinical practice has made absolutely clear. Tinnitus is not a diagnosis. It is a symptom. And in a significant proportion of cases, the cause has nothing to do with the ear itself. It is addressable. By the end of this video, you will know the 4 most overlooked causes. Let us begin. Most people think tinnitus is an ear problem, and sometimes it is. But here's what most explanations miss. The ringing you hear is not produced by your ear. It is produced by your brain. Your auditory system forms a continuous processing chain. When something disrupts any part of that chain, the brain fills in the gap with a phantom signal, a tone, a buzz, a hiss. This is the brain's attempt to compensate for missing or distorted input. Treating the ear alone, when the disruption is elsewhere, will never resolve the ringing. Understanding where the disruption is occurring is the key. I want to tell you about a patient, a 67-year-old retired teacher who had lived with a constant ringing for 2 years. She had had 3 hearing tests, all normal. She had been told definitively there was nothing to be done. When we went through her full picture, jaw tension, neck posture, and blood pressure, 2 specific causes emerged that had never been discussed. Within 8 weeks, she described the ringing as reduced by 60 to 70%. It was no longer dominating her day. She told me, "I did not know there was something left to try." That is what today is about. Cause number 1, restricted blood flow to the inner ear. The cochlea is one of the most metabolically demanding structures in the body. When blood flow is reduced, the hair cells begin to malfunction. They fire spontaneously, sending false signals to the brain. What causes reduced flow? Uncontrolled high blood pressure, arterial stiffness, anemia, and chronic dehydration. If your tinnitus has a pulsing quality, beating in time with your heartbeat, this warrants urgent medical evaluation. The approach begins with blood pressure control, hydration, and a diet supporting vascular health like leafy greens and garlic. Cause number 2, the jaw and neck connection. Your jaw joint sits directly adjacent to the ear canal. When the jaw is chronically tense, this tension transmits directly to the structures of the ear, worsening the ringing. Similarly, the upper cervical spine sits in close proximity to the auditory nerve. Chronic neck tension can compress these structures. If your tinnitus changes when you move your jaw or turn your head, these are strong indicators that the jaw or neck is a factor. Seeing a specialist is best, but a simple habit helps. Gentle neck stretches held for 30 seconds to reduce tension. Cause number 3, medication-induced tinnitus. Over 200 common medications are classified as ototoxic. The most common are high-dose aspirin, certain antibiotics, and loop diuretics used for heart failure. If your tinnitus began with a new medication, talk to your doctor. Never stop or adjust prescribed medication on your own. Cause number 4, nutritional deficiency, specifically zinc and vitamin B12. Zinc is highly concentrated in the cochlea. Vitamin B12 is essential for the myelin sheath protecting the auditory nerve. After age 55, absorption drops significantly. Dietary sources include oysters, red meat, eggs, and dairy. For many over 55, supplementation is necessary. Here is your complete action plan starting today. Book an appointment for a blood test checking zinc and B12. Review your medications and begin consistent daily hydration. Add omega-3 rich foods to support vascular health. The ringing in your ears is telling you something. Now you have the information to listen to what it is saying. Take care of yourself.